Tim Collins with Cullman today. I'm down with Dr. James Lee with Professional Weight Loss Center. Doctor, you have transformed this clinic and doing great things. Tell us about the journey here.
Well, thanks for having me here today and for giving me this wonderful introduction. We noticed back in 2008 with my usual medical clinic that we were starting to have problems with obesity, that people were getting bigger, and they were also having health issues as well, and we knew that there was something that had to be done. So we really wanted to get involved with weight loss. After all, there's also one of the core issues with heart disease. So we acquired this clinic, I'd say about 2014. And in 2015, I had a patient who had a real severe form of congestive heart failure, really weak heart, difficulty with just doing normal activities of daily living, such as bathing and showering. And generally, we tell people with a condition like that it's usually due to a virus, and that over time it will get better. But for this person, after several years, things really didn't get better. Things continued to worsen, and it really affected her lifestyle. On her own, she left the area and she began a new type of therapy. Specifically, it was dietary type therapy. And when she came back, she was feeling much better. She was more energetic. We measured her heart, and her heart was squeezing much better than what it was. And then a year later, it was practically normal. So in many respects, we in the medical system, with our medications and our technology, we really didn't do anything for her. We didn't transform her. She actually did it herself. And that, at that point, was really the eye-opening moment where we really had to take a sobering look at ourselves as clinicians, as physicians, and saying, how much do we really know? And that became my first journey into being curious about functional medicine, about how the human body works, and all the other variables that we haven't really considered. So diving back into the medical literature, into biochemistry, physiology, even historic forms of medicine that were practiced 100 years ago, we started having to relook at things and to change some of the things that we practiced and some of the things that we taught people. So partially this was also an educational moment, and this is what we're trying to bring forward here at the Professional Weight Loss Center.
And so if I understand you correctly, you're bringing those functional medicines, things outside of what most people would think a weight loss clinic would have, to help not only lose weight, but to improve people's wellness and well-being, correct?
That's absolutely right, because indirectly that's really what people are looking for. Okay, they may want to look good in clothes, and that's very important, but at the same time they also want the energy, they want the will to go out and do things, to enjoy life, and to take care of the things that are important to them.
So what can we expect in the future? People know where the weight loss clinic's at. It's down here on South Main. You have plans to expand, to relocate? I mean, how does this look going 5-10 years down the road?
Well, all those things are on the table, and of course we're trying to see where this part of the journey takes us. But in terms of what we're bringing forward online, besides some of the more medical or naturopathic types of practices, as well as trying to take care of gut and gut health, but then we've also brought and found forms of energy medicine that have been resurrected 30 years ago, that had been in place 100 years ago, that we're actually starting to find benefits and find improvements in people's lifestyles, and as well as the weight itself. So this is what we're looking forward moving into the future, that we're trying to really make an impact in people's lives. After all, that's what we're really wanting all along.
Dr. Lee, thanks for talking to me. I appreciate you taking time to do this.
Well, thank you very much.